Stigma in mental health refers to the negative attitudes, beliefs, and stereotypes that lead to the marginalisation of individuals with mental health problems. Stigma creates self-doubt and shame and prevents people from seeking help due to the fear of judgment and discrimination. The war in Ukraine has affected the mental health of Ukrainians at home and abroad, and changed the communities which have welcomed people fleeing the war. Reporting responsibly on the scale of the issue to the public can be a challenge. Conscientious reporting can reduce stigma and promote understanding, while irresponsible coverage can perpetuate stereotypes and misconceptions. Your reporting can foster understanding, raise awareness of this crucial issue, show the impact of adequate and accessible mental health support, destigmatize mental health issues. It's important to remember that refugees and migrants are not solely defined by their identity as migrants and refugees. Acknowledging diversity of identity and history is crucial, such as cultural diversity, language barriers, trauma and displacement, access to services, social integrations. It's crucial to avoid stereotypes in reporting on migrants and refugees, as they often oversimplify complex experiences and reinforce harmful biases. Focusing on individual stories and person-centered narratives ensures a more accurate, compassionate, and humanizing portrayal of their diverse lives and journeys. Stigmatizing language reinforces negative stereotypes and can further marginalize vulnerable groups. Using respectful, accurate language helps to foster understanding and reduce discrimination. For example, you might say mental distress, problems, or issues instead of conditions. Or you might say people with lived experience or experts by experience instead of the mentally ill. When reporting on sensitive topics, it's essential to approach with care and consideration for the individuals involved. This ensures that the coverage is both ethical and respectful, especially when dealing with vulnerable populations. Some areas of caution might be obtaining consent, respecting privacy, and using trigger warnings. Some tips: use person-first language, appropriate language, focus on individual stories of resilience, consult mental health experts for accurate information, use terms free of stigma, use factual descriptions, accurate descriptions concerning the war, use simple language, and using inclusive communication. Try to avoid making assumptions about mental health, sensationalizing, using stigmatizing terminology, invading privacy, referring to material wealth, using complicated terminology. Ethical reporting on mental health plays a vital role in shaping viewers' understanding and attitudes by promoting accurate, respectful narratives. Be mindful of intersectionality and craft human-centered stories that respect and acknowledge people's diverse situations. Obtaining informed consent, respecting privacy, and using trigger warnings are essential practices to protect individuals' well-being. Using non-stigmatizing language and focusing on stories that inspire hope and recovery helps reduce stigma, foster empathy, and encourage a supportive dialogue around mental health. Additionally, ongoing education and sensitivity training for journalists and media professionals is crucial to ensure responsible and compassionate coverage.